through the AV node. So, irregular heartbeat, okay, when there is a block in the transmission of this wave AV node, okay, then also when the cells fail, pacemaker cells fail, then also arrhythmia occurs. So, that arrhythmia is this irregular heartbeat. That can be treated by arrhythmic conditions can be treated by anti-arrhythmic drugs. So, atherosclerosis, hyperthyroidism and lung diseases are the other reasons for causing this arrhythmia. So, main important thing here is classification. Classification, mechanism of action, uses is common. This is the important part in the anti-arrhythmic drugs. So, this anti-arrhythmic drugs are divided into 4 classes. Class 1, class 2, class 3, class 4. Again, class 1 is divided into 3 types, class 1A, 1B, 1C. Okay. Class 1A drugs are sodium channel blockers. Class 1A drugs are sodium channel blockers. 1A, 1B, 1C. Then what is the difference here between this? All these are sodium channel blockers only. Their action is different. 1A drugs are moderate action. Mild to moderate action is seen in class 1B. And marked action is seen in class 1C. Okay. Mild action, mild to moderate is 1B, moderate is 1A, marked action is seen in class 1C. These are sodium channel blockers. Okay. Here some block potassium channels. Some is sodium beta blockers, B for beta blockers, potassium blockers, C for calcium blockers. So, 1, 2, 3, 4. Okay. Class 1, class 2, class 3, class 4. Class 1 are sodium channels blockers. Class 2 are beta channel blockers. Class 3 are potassium channel blockers. Class 4 are calcium channel blockers. For this mnemonic is some block potassium channels. Someone blocked potassium channels. Some S is sodium, B is beta, P is potassium, C is calcium. Okay. This is how we have to remember, or else if you can remember in any other way, that is also fine. But the thing is, you have to remember the action. Okay, which class of drugs are blocking which channels. Next, examples. Examples are quinidine, procainamide and disopyramide. Quinidine, procainamide, disopyramide. These are class 1A drugs. Class 1A drugs, how we will identify quinidine? Double quarter. Okay. Double quarter. That means disopyramide, quinidine, disopyramide, quinidine and procainamide. That is class 1A drugs, moderate action, mild to moderate action, marked action. Okay, double quarter, you just remember like this, double quarter, double D for double D for disopyramide, quarter drug is quinidine drug. Okay, procainamide. Okay, and what is the mechanism of action? Detailed mechanism of action. Moderate to marked sodium channel blockade, this already seen. Important point is it slows phase 0 depolarization. Which phase of this, on which phase it is acting? Class 1A drugs at phase 0. Prolongs action potential duration, slows conduction, intermediate rate of dissociation from sodium channels. So, important point is moderate action and phase 0 depolarization prolongs this action potential. Next, class B, lidocaine, mexiletine, phenytoin, tocainide. Okay, lidocaine, mexiletine, phenytoin, tocainide. Rapid rate of dissociation shortens this phase 3. Here it shortens phase 3. Here it is class 1A phase 0 depolarization, slows phase 0. Here class 1B phase 3 and shortens this action potential duration. Next, this is flecainide, propafenone, morphine. Okay, FM, flecainide. Okay, FPM, foreign prime minister. Flecainide, propafenone, morphine. Okay, okay, flecainide, propafenone, morphine. Okay, more. It is marked. More marked. Morphine. Okay, Prime Minister. More marked Prime Minister. Okay, propafin, morphine, flecainide. Slows the rate of dissociation from sodium, slow conduction. Action is same. On phase 0 is 1A, phase 3 is 1B. Okay, these are the drugs you have to remember. Okay, double quarter is this thing, disopyramide, procainamide and quinidine. Lidocaine, mexiletine, phenytoin, tocainide is class 1B. Flecainide, propafenone, morphine is class 1C. Next, class 2 drugs, you all know, beta blockers. Class 2 beta blockers, potassium channel blockers, class 3, calcium channel blockers, class 4. Okay. And beta blockers, what they do? Beta 1 adrenergic blockers. Which beta? Beta 1. Okay. Beta 1 blockers. Slows phase 4 depolarization. Okay. Phase 0 is class 1A. Phase 3 is class 1B. Phase 4 is class 2. Phase 4 depolarization slows firing of SA node and conduction through AV node, prolonging the repolarization. So, repolarization prolongators. Okay, repolarization prolongators prolongs the repolarization here also. Okay, phase 4 class 2 and class 4. Phase 4 class 4. Class 2 and 4 are phase 4 prolongators or slows down the depolarization. Repolarization prolongators. Okay, potassium channel of phase 3. Okay, you remember like this 4, 3, 4. Okay. 2, 3, 4. Class 2, class 3, class 4 is 4, 3, 4. 2, 3, 4, 4, 3, 4. Class slows phase 4, prolongates phase 3, slows phase 4. Okay. And now coming to the examples. You know all lols. Okay. Lols. Esmolol, acebutolol, sotalol, propranolol, timolol, pindolol. All SADs here, you see, amiodarone, dronidarone. Okay. Bad, bretylium SA, BAD, bretylium, amiodarone, dronidarone. Okay, bretylium, amiodarone, dronidarone. That is potassium blockers. Diltiazem, verapamil, fourth. Okay, fourth, class 4. Class 4 is calcium channel. Diltiazem, you have this I's, this I, verapamil. Okay, verapamil is V. So, class 4, diltiazem, verapamil. Lols, all lols are class 2 beta blockers. Bad is bretylium, amiodarone, dronidarone, class 3 potassium channel blockers. Okay, these are the important points here. Remember and execute well. Phase 0 is sodium channel blockers, quinidine, procainamide, disopyramide. Phase 3 is class 1B, lidocaine, mexiletine, phenytoin, tocainide. Just try to memorize or remember when I am repeating. Okay. Morphine is marked FPM. Flecainide, propafenone, morphine. Beta blockers lols, bad, amiodarone is class 3, class 4 is 1B. Like this. Diltiazem, verapamil. Diltiazem and verapamil. Okay. Next. Class 1A antiarrhythmic drugs. Drugs wise we will see. Important properties, uses and adverse effects. Okay. Quinidine. Quinidine is what? Quinidine is 1A. 1A drug. It is a diastereomer of quinine. Quinine is obtained from the cinchona bark. Okay. It is a basic water soluble salt. Basic drug. Okay. Because it is having this nitrogen in its structure and it is a water soluble salt. It is a diastereomer of quinine. And adverse effects is what? Nausea, vomiting, diarrhea, hearing loss. Hearing loss is the adverse effect of quinidine. Next, procainamide. Procainamide, 1A, short duration of action. Its metabolite is also very active and it is acting as a local anesthetic. Which of the following drug is acting as both local anesthetic as well as antiarrhythmic drug? That is procainamide, used in the treatment of arrhythmias in alcohol withdrawn patients. So, alcohol withdrawn patients are having some, when they are having this antiarrhythmic drugs, procainamide is given, which is also acting as a local anesthetic. Drug-induced lupus syndrome, important here, drug-induced lupus syndrome is an adverse effect. Disopyramid. Name itself, you think it is pyramid in nucleus. That's why I have given here the structure here. It is having pyridine nucleus. Disopyramid consists of pyridine nucleus. And anticholinergic. Which of the following anti-arrhythmic drug has anticholinergic side effects? Anticholinergic side effects are dry mouth, blurred vision, constipation, urinary retention. These 4 are anticholinergic actions which are side effects for disopyramid. Anticholinergic side effects are seen in antiarrhythmic drug disopyramid, that is dry mouth, blurred vision, constipation, urinary retention. Next, Asmalin. Asmalin prolongs phase 3 obtained from the roots of Rauwolfia serpentina. Which of the following drug? See, very important points I am covering here. Okay, quinidine is a diastereomer of quinine. Procainamide, it is anesthetic, antiarrhythmic. Okay, lupus syndrome, in drug-induced lupus syndrome is a side effect. Anticholinergic side effects are seen in disopyramid, which is having pyridine nucleus. Asmalin is a natural one which is obtained from the roots of Rauwolfia serpentina. It is used for the Wolff-Parkinson-White syndrome. Used for the treatment of Wolff-Parkinson-White syndrome, that is Asmalin obtained from the roots of Rauwolfia serpentina. Which is the following drug acts as antiarrhythmic? Which of the following is a class 1 example for naturally obtaining antiarrhythmic drug? That is Asmalin obtained from the roots of Rauwolfia serpentina. Next, class 1B drugs. Important drugs in class 1B, lidocaine, phenytoin. Phenytoin is an anti-epileptic drug also. Weakly acidic drug. Okay, if you see here, weakly basic drug is quinidine. Weakly acidic drug is phenytoin. It's also an anti-epileptic drug. Anesthetic drug is procainamide. Okay, phenytoin, treatment of atrial ventricular arrhythmias resulting from digitalis toxicity. Which of the following drug is used for the treatment of arrhythmias resulting due to alcohol withdrawn? That is procainamide. Arrhythmias obtaining due to digitalis toxicity, phenytoin is used. Okay, and lidocaine adverse effects, emetic and convulsant properties. Okay, next, flecainide, propafenone, morphine, class 1A C. Class 1A C drugs, propafin, morphine, flecainide. So, class 1C drugs. Okay, anesthetic drug, propafenone. Anesthetic drug, procainamide is also anesthetic, procainamide, propafenone. Both are class 1A drugs only, class 1 only. One is A, one is C. Procainamide is class 1A anesthetic, propafenone is class 1C antiarrhythmic anesthetic. And blurred vision, headache, nausea, abdominal pains are flecainide side effects. Next, what is this sotalol comes under? Beta blocker. Beta blocker sotalol, bretylium tosylate, bad I said. Sorry, lols. This is beta blocker. Beta blocker, methane sulfonylide. Okay, sulfonyl group is seen in which beta blocker? Which antiarrhythmic drug? Which of the following antiarrhythmic beta blocker is having sulfonyl group in its structure? Methane sulfonylide, beta blocker, sotalol. Okay. Methane, again see here, methane sulfonamide derivative is also ibutylide, which is a potassium channel blocker. So, both are having, sotalol and ibutylide are having methane sulfonamide in its structure, but the difference is what? One is beta blocker, one is potassium channel blocker. Next, here, which of the following drug is considered as dual class 2 class 3 inhibitor? Dual class 2 class 3 antiarrhythmic drug example is sotalol. Sotalol is dual class 2 class 3 antiarrhythmic drug. Which of the following structure is having quaternary ammonium salt derivative? Which of the following is quaternary ammonium salt derivative? Or which of the following? B for B, bretylium tosylate, bromide derivative. Bretylium tosylate is B for B, bromide derivative, quaternary structure, quaternary ammonium structure, class 1, class potassium channel blocker, class 3. Okay, beryllium tosylate. Potassium channel blockers are bad. Beryllium, amiodarone, dronedarone. So, beryllium tosylate is quaternary ammonium salt with bromine derivative and exhibits polymorphism. Which of the following drug, antiarrhythmic drug, shows polymorphism? Beryllium tosylate. Okay, it is having antiarrhythmic as well as antihypertensive action, and orthostatic hypotension is the adverse effect. Next, benzofuran. Amiodarone is benzofuran derivative. Amiodarone, that is why benzofuran, and it involves Friedel-Crafts acylation reaction in its synthesis. Friedel-Crafts acylation reaction, it is anti-anginal as well as antiarrhythmic. So, important points here, methane sulfonamide derivatives are potassium channel. From potassium channel, it is sotalol. From beta blocker, it is sotalol. From potassium channel, it is epitolide, methane sulfonamide derivatives. Which of the following drug is a benzofuran, amiodarone? Which of the following drug exhibits polymorphism? Beryllium tosylate. And also you can remember its mechanism of action, like see, MBA college. Class 1, membrane stabilizing mechanism of action wise I am telling. Class 2, beta blocker. Class 3, action potential widening. Okay, action potential widening or potassium channel blocker. Class 4 is calcium channel blocker. Next up, procainamide we are discussing about. I want to give here the procainamide IUPAC nomenclature. You see here, see the how many, see, benzene, this is amide group, this is amide group, this is ethylene linkage, this is tertiary nitrogen, tertiary amino group. Okay, this is amine at para position. Okay, para amino N, dimethyl N, N, dimethyl amino ethyl N, 2 dimethyl amino ethyl amide. Which amide? Benzamide. So, benzamide. Para amino dimethyl ethyl benzamide. Okay. This is, see here. So, para amino. So, here important points, what I said, tertiary amine is important for activity. You have here tertiary amine, 2 ethyl groups, and amide, benzamide is there, CONH. To the amide functional group, you have here, okay, CONH, this is the amide group, and substitution is diethyl amino ethyl. Diethyl amino ethyl, this is a substitution on amide that is attached to the para amino benzene, para amino benzamide. Para amino benzamide. Substitution is diethyl amino ethyl. Okay, and important points, procainamide also acting as an anesthetic. It in metabolism, if it undergoes metabolism, it will give rise to 2 active metabolites, para amino benzoic acid and N-acetyl procainamide. Para amino benzoic acid and N-acetyl procainamide. So, N-acetyl procainamide and that is also acetylated metabolite is also active as acting as an arithmetic antiarrhythmic agent. Okay, so this is important points here. Phenytoin, if you see here, 2, 2,4 dione. 1, 2, 3, 4, 5. Phenytoin, this is the structure of phenytoin. Okay, 5,5 diphenyl, this is imidazolidine. Imidazolidine 2,4 dione. Okay, 2,4 dione. This is phenytoin, imidazolidine derivative. Tocainide, this is the tocainide. Tocainide, if you see here, dimethyl phenyl group will be there, dimethyl phenyl group, and this is the amide. Okay, propanamide. Okay, if you see here, 1, 2, 3, second position amino, 2 amino, and N-methyl, 1, 2, 3, 4, 5, 6, 2,6 dimethyl phenyl, propanamide. How many carbons? 3 carbons are there. Okay, 1, 2, 3, 1, 2, 3, 2 amino, N, 2,6 dimethyl phenyl, propanamide hydrochloride, that is tokainamide. One important point here, S enantiomer of propafenone is reported to be 40-fold more potent than R enantiomer. Okay. Yes, S enantiomer is more active than R enantiomer. R and S enantiomers exhibit similar sodium channel blocking effects. S enantiomer exhibits beta adrenergic blockade. Here, R and S enantiomers, R and S both exhibit sodium channel blockage activity, propafenone. Okay, and S enantiomer marked beta adrenergic. Okay, that is why S enantiomer is having both activities, sodium as well as beta adrenergic blocker activity, propafenone. Okay, that is why S enantiomer is more active than R enantiomer. Yes, this is correct and this is a correct explanation for A. And if you see here, this whatever the different drugs are there, so important drugs like phenytoin, tokainide, propafenone, okay. These drug structures you remember, rest of the things, the important nucleus that is present that I have given. See, morcizin is having phenothiazine. Okay, that important nucleus, that chemistry wise you remember. Okay, thank you, all the best.